Section 4. Psychological explanations. Family systems theory. Family systems theory suggests that individuals cannot be understood in isolation from one another, but rather as a part of a family system of interconnected individuals. Double-bind, Bateson, 1956, suggested that schizophrenia might be the result of being caught in a double-bind situation. When an individual repeatedly receives two or more conflicting messages, in which one message contradicts the other. This means that the person will automatically be wrong regardless of their response. This could then lead to various types of schizophrenic behavior depending on how the child dealt with the double binds. One individual may become excessively suspicious and always looking for hidden meanings. Another may try to ignore their surroundings, or they may try to accept everything at face value and react in an emotionally inappropriate manner. Evaluation of the double-bind theory. Inconclusive evidence. Berger, 1956, found that schizophrenics reported a higher recall of double-bind statements by their mothers than non-schizophrenics. However, this evidence is retrospective and therefore data may be biased and lack validity. However, Hall and Levin, 1980, analysed data from previous studies and found no difference between families with and without schizophrenic family member in the number of double binds observed. Expressed emotion. Although evidence for double bind is not clear, there is evidence that high expressed emotion within a family could cause schizophrenia. High expressed emotion refers to a pattern of criticism and hostility in relatives of people with schizophrenia. Implication and evaluation. Prospective studies. Monitor children over a period of years to see who develops schizophrenia. Marcus, 1987, followed high-risk children who had a parent with schizophrenia. They found that high-risk children who went on to develop schizophrenia were more likely to come from families characterized by negative relationships. However, among the high-risk group, none of those who had received good parenting went on to develop schizophrenia. This shows that family environment plays a role in the onset of schizophrenia. Studies are correlational, so it is not possible to say whether expressed emotion causes schizophrenia, or whether it is caused by living with a family member with schizophrenia. There is evidence that high expressed emotion is response to living with schizophrenia. High expressed emotion is less common in families of the first episode schizophrenics than in those with frequent readmissions, suggesting that high expressed emotion may develop as a result of the distress caused by living with a person with schizophrenia, and is more linked to relapse. High expressed emotion has also been found in families of patients with other disorders such as depression or eating disorders, so cannot be a distinguishing characteristic of schizophrenia. Psychological explanations have been used to develop effective interventions for schizophrenia. Expressed emotion is the basis of family intervention methods, which have had some success at reducing relapse rates. This suggests family dynamics play an important role in the development of schizophrenia. Cognitive approaches. Frith's attention deficit model. According to this model, schizophrenia is the result of a faulty attention system. Frith, 1992, suggests that schizophrenia occurs due to a faulty information processing, leading to cognitive overload. The schizophrenic is unable to distinguish effectively between their thoughts and outside stimuli, hence experiences hallucinations. For most people, there is a filter between conscious and pre-conscious levels of cognitive processing. Pre-conscious thoughts, i.e. which occurs without awareness, contains huge quantities of information from our sense that would normally be filtered, leaving only a small amount to enter into conscious thought. Frith suggests when people have schizophrenia, this filter breaks down and information from the preconscious arrives in the conscious, where it is misinterpreted and seen as something important that needs to be acted on. This can explain delusions. A person with schizophrenia may also wrongly interpret internal preconscious non-speech sounds as speech, which may seep into consciousness, which are then experienced as voices. This can explain auditory hallucinations. Finally, because there is a problem with attention, people with schizophrenia have difficulty focusing on anything for a period of time, giving the impression of disordered thought. Frith believes that this faulty filter is due to the disruption of neural pathways connecting the hippocampus to the prefrontal cortex, which is linked to the faulty regulation of dopamine in this part of the brain. Evaluation. Brain activity. Frith provides limited support by showing that there is reduced cerebral blood flow in the neural pathways connecting the hippocampus to the prefrontal cortex, indicating reduced brain activity when people with schizophrenia are engaged in cognitive tasks. Support for the assumption that people with schizophrenia have problems with attention comes from Shen et al. 2013, who compared 86 people with schizophrenia and 86 controls. They carried out 13 different computerized tests, for example, pressing a response key whenever a cross appears on the screen, and found that people with schizophrenia performed significantly worse on tasks that required sustained and focused attention. This shows that schizophrenia may be linked to an attention deficit, as predicted by the model. However, McKenna 1994 found that schizophrenics do not seem to be any easier to distract than normal people when engaged in cognitive tasks. This challenges the idea that schizophrenia is the result of cognitive deficits. Conclusion: the cause of schizophrenia is due to an interaction between biological and environmental factors. The diathesis stress model links genetic predisposition of schizophrenia with life events. In schizophrenia, a genetic vulnerability may lead to a biochemical abnormality with, for example, the dopamine system. This could lead to the ability to process information abnormally, attention deficit model. The addition of disrupted family communications could then be enough to trigger the development of schizophrenia.